Welcome back. I'm Orla alongside Andrea. How is your skin doing these days? The dry, cold winter air is always tough on our skin and can often leave it dry and cracking. Not to mention that we are probably all washing our hands more and using plenty of hand sanitizer. So, what can you do to combat that dry winter skin? Dr. Lisa Kellett, dermatologist at DLK on Avenue in Toronto, joins us. Hi, Dr. Collette. Great to speak to you again.
Great, thank you.
So, why does our skin give us so many issues and get so dry in the wintertime?
Well, you can blame it basically on the weather, and there are a number of things. As we have wind, we have cold, both of which contribute to what we call transepidermal water loss. So we lose water from the surface of the skin, and then it becomes dry and cracked.
And I'd like to hope that most people are washing their hands more than ever these days. And we're also using a lot of hand sanitizer. What role does that play in drying out our skin?
So that is like kind of a double whammy. So not only do we have to combat the weather, but we also have to combat the use of basically hand-based sanitizers which contain alcohol, and that also contributes to dryness, cracking, and irritation.
Are there any hand sanitizers right off the bat that you would recommend? Obviously, they have to have the alcohol in them to kill bacteria, but any that are kinder to our skin that we should be on the lookout for?
Right. Just because it's so hard to find hand sanitizers, I actually think the alcohol-based ones are the safest right now, because it's very hard to find ones that are not, just because of what's going on now. But there are some tips that you can use to help.
Oh,
So what I tell patients is at nighttime before you go to sleep, wash your hands, make sure they're clean, and apply a barrier cream. So you can find these at the drugstore, and they tend to be thicker than most hand creams. So I suggest that you put a barrier cream on, and then go and get cotton gloves and put the cotton gloves on top, and you go to sleep with a barrier cream and cotton gloves.
looking like a magician.
Exactly. Well, no one sees you when you're sleeping, so it's
Yeah.
a good time to do it.
And is that like an Aquaphor type sort of cream that we're talking about?
Right, Aquaphor, another one, Cetaphil has a good barrier cream as well. And as I said, you have to look for them because they'll actually see barrier cream on them, and they're thick. It's not just a regular body lotion. They're thick, and they do help in terms of skin. And then you can also use them on your feet, too. So what I get my patients to do is to go into a bath or shower, use a loofah, get rid of all the dead skin, put the barrier cream on, wrap your feet up with saran wrap, and then put your feet in cotton gloves or cotton socks just to kind of increase the absorption of their barrier cream. So you're going to be looking good with the cotton socks and the gloves at night.
Hey, we all have to make an effort, right, to get somewhere. Now, is that something you would be doing nightly or once a week? What's the frequency there?
It depends. I mean, for healthcare workers or first-line workers who are actually washing their hands quite a bit, I would suggest doing it nightly or even on the days that you're off. If you're off at home, put the barrier cream on and put your hands in some cotton gloves and just walk around with those during the day.
We're chatting to Dr. Lisa Collette, dermatologist at DLK on Avenue in Toronto. One thing I dislike about the winter, along with everyone else, Dr. Collette, is how the skin on our faces becomes so dry and dehydrated with the heating, with the heating in the car, heating in the house, the general temperature outside. How can we hydrate daily? Like, should we be using creams, maybe oils? What would you suggest?
Okay, so I have some tips for that as well. So if you tend to be flaky, I suggest a very mild exfoliating cleanser. So you want to get rid of the dead skin cells first. So look for a cleanser with exfoliating beads in it, not something with an acid in it. Stay away from those. They're too irritating in the winter. So stick with beads. And then after, while your face is still wet, you apply a cream to your skin. If you're prone to acne, you can actually use a gel-based moisturizer. So apply that to wet skin, wait 5 minutes, and then put another layer on.
And is that best done in the morning?
You can do it in the morning and at night, depending on how dry you are. And then if you are out, try to cover up. I mean, the mask now is going to do double duty, a cloth mask. It'll cover up your skin and protect you and those around you with COVID. But that kind of would be a good idea to use both and make sure you're protected during the day.
Dr. Kellett, I'm seeing a lot everywhere for moisturizing setting sprays. Are they also a good idea to have in your bag and just give your face a quick spritz when you're out to constantly moisturize during the winter time?
I mean, the best thing is actually, the trick is to actually, if you're home, put a moisturizer on wet skin and then put another layer on. If you're not prone to acne, you can use a cream, and that tends to be quite effective at decreasing transepidermal water loss and giving you some hydration.
Is it possible to overdo it, like putting on like tons of oils and moisturizers and, make
it
your
is
skin
possible,
worse?
And those patients that we worry about would be those patients who are prone to acne to begin with. So in my acne-prone patients, I instruct them to use gel-based moisturizers as opposed to creams and lotions.
Dr. Kellett, I know oil and water don't mix. So if your face is wet, you're recommending just putting the moisturizing cream on top. Would you also recommend putting the oil?
Oils, the only thing with oils is if you are very, very dry, you don't tend to break out, then you can use an oil. But the issue with the oils is that they can cause acne underneath the mask. So that is the only issue with the oils that I would caution patients about.
Does dry skin cause our skin to age prematurely?
That is actually a myth.
Oh, that's good.
That's a myth. So what we see as dry skin is actually an increase in transepidermal water loss. So as I said, the best thing that I instruct my patients to do is to use an exfoliating cleanser and then put the moisturizer on wet skin.
One more question I have. I'm not sure if it's a myth or not. Does drinking a lot of water help to hydrate our skin, or is that not true?
That is a myth.
Ooh,
if you drink
good to
too much
know.
water,
Oh,
you know what
my
will
goodness.
happen. You'll be running to the loo.
Okay.
Okay, if that was the case, then we would drink water and we would explode if it went right to our skin. So it doesn't work that way because the water goes into your stomach. It doesn't go to your skin.
That is so good to know. I can't tell you how many
Yes.
times I've
Yes.
been even for a facial and had somebody tell me that I need to drink more water. So I'm happy to know that I'm not as dehydrated as I thought I was.
No, water is good for your kidneys, but it does
Okay.
not go right to your skin.
And just before we let you go, Dr. Kellett, what about chapped lips? What's the best way and the best product to use to keep our lips moisturized?
Okay, so a couple more tips. So gentle, when you're using exfoliator on your skin, you can use a little bit on your lips. And then what I instruct my patients to do is to find a lip balm that contains an SPF that is more of a waxy texture. They tend to decrease the loss of water from the surface of the skin better than others. So don't go for a gloss. Go for more of a lip balm that contains an SPF because remember, even during the winter, you need to protect your skin.
Absolutely. Thank you so much for joining us today. Andrea and I love talking about skincare.
So do I, thanks.
That's Dr. Lisa Kellett, dermatologist at DLK on Avenue in Toronto. Coming up, everything you need to